in terms of aged care, whilst we are seeing a decrease in the number of active cases, we do know that there are significant pressures in specific facilities. So far, we've taken a series of measures. In particular, 80,000 shifts have been put in place. We've delivered over 120 million units of PPE, including 40 million units this year. And significantly, we've had 10.7 million rapid antigen tests that have been delivered to aged care continuously since August of last year, and already 5.25 million rapid antigen tests have been delivered through the pensioners and concession card holders scheme, where people go to the pharmacies and collect them. So all of those things are coming together. Obviously, Peter will give you more information in relation to the work of the ADF, but essentially there are three components. One is the clinical teams or the clinical support teams. These will stand alongside what we have as clinical first responders. Generally, these will be teams of 10, as the Prime Minister has set out. They'll grow from 4 to 10 teams, and they'll provide that additional support. What we may see sometimes is that the infection control leads or the clinical leads in a particular facility have had to furlough either because they're a case or because they're strongly symptomatic in a close contact. We've relaxed the rules in relation to close contacts who are asymptomatic working. That has been very important in bringing significant numbers of workforce back into the field. The second group and second task of the ADF is to provide the general support, and that general support may be in terms of waste management, PPE management, other forms of assistance under the direction of the clinical leads within the particular facility. And thirdly is to support that deployment with logistical and planning work. So they're the three particular roles, and I want to thank Peter, through you and Prime Minister, the ADF for making this support available. Thank you.
Thank you, Greg. Peter.
Thanks, PM Greg and Karen. I want to say thank you very much to the Australian Defence Force and men and women, 24,000 of whom have already contributed in various ways over the course of Operation COVID Assist. And as of the weekend, as the Prime Minister pointed out, they've now taken up additional duties in providing assistance to those most in need within our aged care facilities. So that work started on Saturday, and as the Prime Minister mentioned before, following his conversation with the VCDF a couple of weeks ago, that planning and monitoring has taken place, and there's a lot of logistical effort behind the scenes to gauge what response is required. But this is a significant intervention by the Australian Defence Force. Up to 1,700 of our personnel will provide assistance at our aged care facilities, and in particular at those that are most in need. Greg has led obviously the effort within health to augment and to provide additional support to the aged care facilities, and we will come in behind that. As the PM pointed out, the hundreds of thousands who are involved in this workforce need support, and we're going to provide them with that support, but we can't replace that workforce, nor would we want to try and do that. I want to also mention that we're going to deploy up to about 15 military planners to the Department of Health to aid in the coordination of the ADF support to the aged care facilities. And again, just acknowledge the fact that the Australian men and women of the Defence Force have really made a significant contribution, as to their families. Many have been deployed away from their own kids and their own domestic needs, and I really acknowledge the sacrifice that they've made as well. Thank you.